And our presentation is over sleep within nursing facilities by Megan, Cameron, Hannah, Lexi, and Elizabeth. We are from the Occupational Therapy graduate program, and we have taken a real interest over sleep within our past time at this program.
So for our presentation, we defined our area of need as the occupation of sleep within the geriatric population. And that was simply because in the Evansville area, there are no resources to support the occupation of sleep for the geriatric population, specifically within skilled nursing facilities. And with that, sleep is an important occupation that impacts almost all other occupations, whether that be ADLs, IADLs, basically any other aspect of your daily life. And this also impacts one's ability to functionally participate on a day to day basis.
In the occupational therapy practice framework, sleep is identified as an activity of daily living and defined as an activity related to obtaining restorative rest and sleep to support healthy, active engagement in other occupations.
Occupational Therapy Practice Framework is a document by the American Occupational Therapy Association that guides what occupational therapy truly is and how we should deliver our services. So, this is a huge document that occupational therapists and occupational therapy assistants follow to know how to deliver services in all different types of settings. So it is a huge indicator when sleep is in this document that it's something we need to address.
After looking through multiple studies and finding different statistics, not necessarily just for Evansville, but nationwide, there's a great need to address the occupation of sleep. As we found that there are estimated between 40 to 70% of older adults that have chronic sleep problems, and up to 50% of those cases are undiagnosed. So, again, there's so many people that are having chronic sleep problems, sleep apnea, all those things, but they're being undiagnosed because there's not really resources for them to look at where to get help or how to address it. And then when looking at the geriatric population, specifically within skilled nursing facilities, about 43% of community dwelling adults report difficulty with sleep onset or maintenance, and 25% report napping during times that you necessarily shouldn't be napping, whether that's daytime napping or getting their sleep schedules mixed up just because of the difficulty sleeping or maintaining sleep throughout the night. So, sleep currently is not a priority in most settings and is often just looked past. So, it's kind of one of those things where people ask if you sleep well and they just document, yes, they did, or no, they didn't. It's not really being addressed, or people aren't really giving ideas to help increase proper sleep. And then as we age, sleep becomes more fragmented and there are increased risk of things like daytime napping and awakenings during the night. And this is super common within nursing homes due to a variety of factors, whether they be environmental, physical, or mental. And again, more than 1/3 of adults sleep less than 7 hours per night, which is the recommended amount of sleep. And it's recommended that between 6 to 9 hours is ideal for improved cognition and day to day function. So it is imperative for us as occupational therapy practitioners to find ways to either modify the environment or address physical and mental needs that can help increase the amount of hours slept per night to meet the ideal amount.
Severity and impact. Sleep is an important aspect of daily life. However, many nursing facilities do not monitor or evaluate the sleeping habits of their residents. Because of this, many residents may suffer from an increased risk of diabetes, cardiovascular disease, obesity, and depression. Older adults often have disrupted sleep patterns as well. The disruptions are caused from difficulty falling asleep, waking several times during the night, and waking earlier in the mornings. Many older adults often spend less time in a deep sleep and wake often due to nocturia and chronic pain. Around 50% of older adults complain about sleep problems. These sleep problems can lead to impaired cognition, disorientation, delirium, and an increased risk of falls.
Community level indicators. There was not a lot of data for sleep in Evansville, Indiana. However, there was a lot of data with sleep within Indiana as a whole. Age adjusted prevalence of short sleep duration was reported among 37.9 of the Indiana population, placing it at a more risk state. The state percentage was then broken down into Indiana county percentages. Vanderburgh County was at 36.7, Lake County at 40.1, Madison County at 40.3, Sullivan County at 39.9, and Harrison County at 40.0, which you can tell that Vanderburgh County is up there, so it could be a more at-risk state.
In the United States, there are around 50 to 70 million adults who have sleep disorders. 1 of 3 adults do not get the recommended amount of sleep needed to protect their health. Sleep disorders affect every race, ethnicity, socioeconomic status, age, and sex. Within nursing homes, there are more female residents than men, and women have more trouble falling asleep compared to men. The needs assessment would inform the nurses, aides, techs, and CNAs as they see the patients more often, the patients or residents of the skilled nursing facility. This includes their family members or caregivers, social workers within the facility, and the patient's medical care team. Information is then assessed and processed by Medicare and Medicaid for billing purposes or private insurance companies.
Sleep is an essential occupation that can affect our health and well-being and participation in daily activities. To maintain proper physical and cognitive functioning and carrying out our everyday tasks, proper sleep patterns are vital. Sleep also has a significant impact on our mood and energy levels, which are critical components to engage in day-to-day activities. If we are not getting enough sleep, individuals are at a greater risk for chronic diseases such as stroke, diabetes, depression, and heart disease.
Therapy, it's really important to know how to address sleep dysfunction and issues at a person, group, and population level, depending on the setting you are in. So, at a person level, just treating one individual, creating a suitable sleep environment with distinct day/night visualization for a SNF resident with Alzheimer's to promote cognitive and physical functioning for daytime activities. And then a group level is hosting a group mind body exercise class in the late afternoon to decrease arousal levels to prepare for better sleep for SNF residents. And then a population level, creating visual and easily understandable posters to hang up around local SNFs to increase awareness regarding sleep, the benefits, and ways to enhance sleep.
So during our stakeholder interview, we decided to interview Kendall Kirker, who is a PT at West River Health Campus, which is a local SNF in Evansville. And she works with nursing staff, OTs, OTAs, PTAs, and speech language pathologists. And she has a direct contact with the management and is the program coordinator herself. So we figured she would be ideal to interview to kind of see her opinion on the occupation of sleep within their own skilled nursing facility.
These next 2 slides are a list of questions we asked our stakeholder during our interview, focusing on the importance and feasibility of addressing sleep in a skilled nursing facility setting. So for our first set of questions, we asked our stakeholder where she worked and what was her role in the facility. Did she receive any education, and how she felt about addressing sleep in treatment sessions for patients, and then how she would track sleep. To wrap up our interview, we asked our stakeholder about funding for specific needs such as sleep, other disciplines that can possibly address sleep in a skilled nursing facility, and the feasibility of addressing sleep in this setting after all considerations.
Project, we were asked to come up with an elevator speech to generally let the public know what we were going to be talking about and the importance of it. So this is ours. My group and I are taking an extensive view of the geriatric population's psychological, physical, emotional, environmental, and social makeup to assess the holistic impact of sleep dysfunction on the entire body and mind. Sleep has really sparked our interest as research has shown the geriatric population is at a greater risk for sleep dysfunction in the aging process, but the aging process does not decrease the need for sleep whatsoever. Consequences of poor sleep include poor physical health, poor mental health, such as depression, cognitive decline, disability in activities of daily living, poor quality of life, increased falls, cardiovascular disease, and much more, as each individual is different. Thus, our solution is to create and locate accessible resources regarding sleep dysfunction for the geriatric population in Evansville, Indiana, in hopes of mitigating and preventing the negative outcomes of poor sleep.
Systems and structures. So there are regulations of SNFs that provide laws and regulations based upon their own specific facility. In our interview with West River Health Campus, there were regulations that included rehab to home patients sleeping in hospital beds rather than just personal beds. They weren't able to be brought to the facility because of the movements and positioning in bed that they were doing during rehab. Some skilled nursing facilities will allow mattress toppers to go over the bed, but some others may not. The Omnibus Budget Reconciliation Act helps follow rules and regulations in nursing homes, which helps with residents' overall well being. OBRA in 1987 was responsible for the quality and care of residents living in nursing homes. Sleep can be taken into consideration by employees of skilled nursing facilities because it is a requirement to address residents' health mentally and physically while they're there at the skilled nursing facility.
During our stakeholder interview, we asked our stakeholder to ID important issues to the skilled nursing facility about addressing sleep and implementing interventions related to sleep. One of the main issues was staff shortages. At this facility, the nursing staff are there throughout the day and night, but the OTs and PTs are only there during the day, so they are less involved in the patient's sleep schedules and habits. There is also a lack of education and training on sleep, and as this facility has memory care units, many patients aren't able to communicate their concerns regarding sleep dysfunction due to their cognitive impairments. In this specific skilled nursing facility, sleep is not considered a priority to address during evaluations or interventions. They have tools available through other disciplines, but the lack of education and training for OT practitioners does not provide enough support to address this area of occupation. Most often, patients are referred to other professionals to address sleep problems.
So, the biggest takeaways for the impact of addressing improper sleep, the biggest ones are it can improve cognitive function, decrease the risk of other chronic diseases, increase participation in daily activities. It can allow people to participate more in therapy, and we can see better outcomes if they are sleeping properly. And then it would decrease daytime napping and nighttime awakenings, as well as decrease agitation and irritability during the day.
In the article, The Sleep Patterns and Their Associations with Mental Health Among Nursing Home Residents, a Latent Profile Approach, conducted by Moy et al. 2023. It was conducted as a cross-sectional study with 353 participants that was able to address sleep patterns associated to mental health in nursing home residents. Sleep patterns were addressed through the Pittsburgh Sleep Quality Index, Patient Health Questionnaire 9, and the Anxiety Disorder Scale 2. The research had found that there was an association between health characteristics and sleep based on 3 various sleep patterns in the skilled nursing facility. Residents with poor sleep patterns were more likely to experience negative effects within their mental health while at the stay in a nursing home.
The article that I found is titled Occupational Therapy Practice Guidelines for Adults with Chronic Conditions. It's a systematic review, which means that it looked at published scientific research and included 102 articles. This document was created to educate and guide occupational therapy practitioners when working with community dwelling adults, so those who live within a SNF, who have chronic conditions. The interventions address several ADLs, such as rest and sleep, as well as IADLs. The study question posed was, what is the effectiveness of self management interventions to improve performance of ADLs and rest and sleep for the community dwelling adults living with chronic conditions? The review found strong to moderate evidence that supports the clinical recommendations for the use of self management interventions when addressing rest and sleep.
The article that I looked into was what is occupational therapy's role in addressing sleep problems among older adults. And this article was a systematic review. So it looked over random control trials, pre test and post test findings, case studies, and other systematic reviews. And the purpose of this article was to examine existing evidence on sleep interventions for older adults that fall within the scope of occupational therapy practice. And then this article kind of took time to provide suggestions for future directions in occupational therapy research and practice to address sleep in older populations. And basically, what they found was that there are 4 areas of intervention that included cognitive behavioral therapy for insomnia, increased physical activity, multi component interventions, and other interventions such as bright light therapy or modifying the environment. And overall, these interventions would just help the role of OT through improving performance patterns, habits, routines, and just overall improving one's quality of life. It's essential for OTs to evaluate sleep in older populations and use these evidence based interventions to treat these issues. One of the most impactful ones, and I think the easiest ones to apply to skilled nursing facilities more readily, is the modifications to the environment. So just making sure that they have a quiet environment to sleep in, that the lighting's okay when they leave, but also just looking into the different aspects of keeping them physically active, keeping them engaged in activities during the day to reduce things like the daytime napping and hopefully reduce the agitation and everything else.
The article that I looked into for sleep management was sleep management within skilled nursing facilities, which was a practice survey. The level ranking was a 5, and it was a cross sectional descriptive survey. The rating of strength was moderate, and the purpose of the study was to examine strategies OT practitioners use to help patients manage their sleep in skilled nursing facilities. Overall, 105 OTs and OTAs participated in the study to identify sleep practices among practitioners in a skilled nursing facility. Participants were provided a survey with 18 fixed choice questions regarding assessments, interventions, documentation, and billing. Sleep deficits were found to be prevalent among patients. However, more than half of the participants report they do not screen or assess their patients' sleep due to a lack of available education and training.
Article that really stuck out to me was titled Occupational Therapy Practice in Sleep Management, a Review of Conceptual Models and Research Evidence by Ho and Su 2018. So the level of ranking of this evidence was 1A, which is the best, but the lower level of evidence studies were utilized within the systematic review. So there were all types of levels used in this review, but it ultimately was a 1A. So, identifying the type of evidence. This was a systematic review of literature that looked at random controlled trials, non-randomized studies, one group non-randomized pre-test and post-test, and case series. So the rating of this strength was strong. So the summary in a little blip is after deciphering the literature that met the inclusive criteria for this systematic review, Ho and Sue developed a 3-level approach to occupation-based sleep management, mirroring the person environment occupation performance framework, which is a framework in occupational therapy that occupational therapists use quite often. So at the person level, when talking about sleep, you're going to look at the bodily functions. When looking at the environment level regarding sleep, you're going to look at promoting sleep environment to meet those needs. When talking about occupation, you're going to increase their daytime activity. And then enhanced performance will naturally follow, meaning sleep will naturally follow if these person, environment, and occupation needs are met.
The solution to the need. For occupational therapy practitioners, continuing education classes can be provided, training and education for the SNF staff and caregivers, implementing sleep logs for residents, which would include self reporting logs and staff reporting logs. And then education would be provided on how to modify environmental factors, address psychological factors, adjust diet and exercise, decrease daytime napping, increase meaningful participation in occupations, and establish a bedtime routine.
The consultation process at the person level. Some examples would be collaborating individually with residents to identify contextual factors that are affecting their sleep while being in the SNF, identifying assistive devices that would be effective for resident sleep quality, contacting the resident's primary care physicians to discuss alternative methods to increase their sleep, caregiver education, collaborating with other members of a resident's care team to develop proper intervention to enhance sleep while their stay at the SNF. The consultation process at the group level in a SNF would be mind-body exercise classes, sleep support groups, and consistent daytime activities for the residents at the SNF. The consultation process at the population level examples include conducting continuing education courses or resources to share with other OT practitioners, developing universal, informative, and holistic-based handouts to share with SNFs, doctors' offices, family members, and patients, research effective environmental modifications and sharing findings with potential funding sources, reaching out to funding sources and/or companies, and presenting all the findings regarding sleep and SNFs. Meet with other professionals in the healthcare field to build an interdisciplinary team to tackle the need of sleep resources for the geriatric population. Hosting annual meetings with administrative boards in SNFs, and hosting annual training for staff at the SNF.
Another common disorder that disrupts sleep is obstructive sleep apnea, which this has taken patients 11.6 to 16.2 months to complete an evaluation and management of obstructive sleep apnea when just going through one provider, such as their doctor, rather than seeking out other consultation processes. So, consultation with other medical professionals decreased this time substantially as the patients received a well reasoned, quickly delivered collective treatment plan rather than multiple isolated opinions at multiple different occasions. So, this could include weight loss, lifestyle interventions through therapy, assistive devices, surgery, and then psychiatry.
There are several healthcare professionals that can help older adults who have sleep issues. Occupational therapists can help by addressing factors that exacerbate poor sleep quality. They can also work to alter and eliminate negative environmental factors. Psychiatrists and psychologists can address psychological aspects. And then there are neurologists, respiratory therapists, pulmonologists, physicians, sleep medicine specialists, and sleep technologists, as well as social workers who can work to resolve these issues.